think it was a fascinating session to see how many people could identify different problems that prevent us from achieving the Millennium Development Goal, which is really trying to reduce child mortality. Everybody identified what the problems are. What I'm missing a bit is still that people do not come up with what would be the practical solutions. And it's always interesting to see other internal politics that people don't want to voice actually what are the problems and who could help to solve them, because we depend, many of us, on the same funding. Or is it that it's actually hard to formulate practical solutions and take responsibility and accountability for making sure that they get implemented? So coming back again, why is it that we are so good at knowing what's wrong, but we're not too good at saying how we can actually prevent wrong things from happening and improve the system? Too little specifics in terms of calculating how, if we say that the funding is missing in order to produce or scale up availability of solutions to save more children, access to different drugs, why is it so difficult to formulate what would be the best mechanism to actually mobilize that funding, where to get it from, and specify how much of it is needed? When we say that we don't have good delivery systems in the rural communities where most of the poor live and where most of the children die, especially in sub-Saharan Africa, why is it so difficult for us to actually say, well, we need to scale up the workforce, we need to have more community health workers, or we need to have more physicians and nurses, and these are the three ways how we can do that. So I think all of us, and there were fantastic speakers, do a fantastic job in their particular niche, and the hard part is really linking all that work together and try to come up with a more holistic approach how we can address some of the problems. There were several examples of companies doing good and really investing their money and their time in creating sustainable projects in developing countries. We had an example from Danone in India doing it jointly with Grameen Bank, an excellent effort which I think has a great potential of being scaled up and impact a lot of lives of children. There are companies that are rarely collaborating with other companies, and there are some efforts which are great efforts, but the scale is too small. So it's once again understanding that in order to have a bigger impact and really impact the MDG4, meaning cutting down the death of children by 3/4 by 2015, the question is, how can we more collaborate and create better mechanisms to make it possible for us to collaborate to reach those goals?